it is recording.
I use my phone a lot for my Dungeons and Dragons games.
Okay, good.
Yeah.
All right. Hi, this is Ruth Werner, and this is our audio-visual sidebar to the article in this edition of Massage Bodywork magazine called Why People Faint. And I cannot tell you how thrilled I am to introduce our guest today. This is Nathan Werner, my son, of whom I am unspeakably proud. He is a paramedic firefighter, and he's a person I often consult in issues around first aid and medical emergencies and sort of being on scene. So I'm just so thrilled that Nathan could be with us today. Thank you for joining us, Nathan.
Happy to be here.
Really, I'm so excited about this. When I told Nathan that I was going to be writing an article about syncope, he immediately, like within moments, started texting to me lists of why people faint. And we've had a few conversations about things that he has seen in the field. You deal with people in the context of syncope with some frequency, yes?
Some frequency.
One of the things I want to point out is that in the construction of this article, Nathan helped me a lot with building out the things that are most important to know. And he is here consulting his phone, not because he's actually playing Dungeons and Dragons, right?
Okay, yeah.
But because he has lists of things he wants to make sure that we cover. I thought it would be really great to have you talk to us, Nathan. Let's start with risk factors. Who is, if you think about people going in for a massage, what kinds of populations would we expect to be most at risk for an unexpected fainting event or near fainting event?
Yeah. So there are a number of risk factors that can predispose somebody to losing consciousness unexpectedly. Age can be one of the more common ones. Anybody over 65 is already going to be a little bit more predisposed to other health conditions that can result in syncope as a condition. And you have to remember that syncope is usually a symptom more than it is a condition.
A freestanding disorder, right?
Right. It's associated with something underlying, right?
Right.
And so that's some of the other risk factors that we have to consider amongst the elderly and amongst all of our patients of all walks. So having a history of fainting or dizziness just in general related to whatever other conditions they have, if they do have a history of passing out, that's something that's
relevant.
Yeah, that you should hopefully be able to address in an intake form of some kind. Anybody with a history of low blood pressure or frequently becoming dehydrated, whether that's because of medications or irritable bowel syndrome or any other conditions that can lead to that, just generally being, in the medical term, hypovolemic, can be predisposed to syncope. Patients with a history of anxiety and intense emotional response or emotional distresses can lead to sometimes the brain has to shut itself down when dealing with their various traumas.
And let me interrupt there for just a moment and say a few words about this. When, as I am fond of saying, when I went to massage school, there was a certain level of what I thought at the time was a certain sort of mythology around what we learned as the vasovagal reflex and deep tissue massage, causing, if you like, these sort of emotional releases. That's a whole different story that we'll save for another time. But there is some truth in the possibility that a specific mechanical distortion, especially associated with pain and fear, could elicit a response like this. Is that fair to say?
Yeah, absolutely. Absolutely. Some other risk factors that we're looking out for are patients that have a history of diabetes, could become hypoglycemic, other metabolic conditions, or are making life decisions that affect you metabolically, such as fasting or dietary decisions.
Right. And another thing we talked about as we were preparing for this was if someone, maybe has been on meds that manage blood clotting or blood pressure for a prolonged period of time, but if they've had a recent change, either in the medication or in something else about their life, like they've gained a lot of weight or they've lost a lot of weight or other things that could alter how these meds work, that's another thing that might elicit
Exactly.
this kind of
Anything
response.
beta blockers, blood thinners, anything with an inotropic effect on your heart's.
A what kind of
Sorry,
effect?
an effect on your heart's ability to pump blood.
Newers? Awesome. Thank you.
Yeah.
Okay, so thank you for that sort of picture of who's going to be most at risk. But let's talk about someone who has pre-syncope symptoms in a massage setting. Right, so someone suddenly in the course of a massage feels nauseated, maybe they break into a cold sweat, maybe they feel clammy, all of a sudden or whatever, and they're very, very uncomfortable. What are some things that you think a massage therapist who is not a first responder should do? And then I'll tell you if I think that's within our scope of practice.
Okay. So, first of all, with every syncopal event is going to be completely unique. Everything is going to be dependent on the context of the cause and the medical history. So where the real work begins comes in understanding your patient before the event itself happens, if it's at all possible. So getting a good medical history, getting a good understanding of their living conditions or their living habits. So some other things that you can do to address somebody who is pre-syncope but still having symptoms. Well, we're going to be talking about carotid pressure.
In the article, you will read about carotid sinus pressure.
Carotid sinus pressure. So anybody with a history of that, you want to avoid neck pressure.
Just make sure there's nothing pressing on their neck.
You want to tend to any slow positional changes. So if they're already laying down, you might consider elevating the legs. There is some.
We can do that with bolsters.
We can. I was going to say there is some debate in the medical community on the effectiveness of elevated limbs in the treatment of hypotension and shock. The science behind it was, or the idea behind it is that by doing this, it helps blood flow return to the core and to the brain, and that makes a sort of logical sense. There is, as I understand it, not a lot of data actually backing up successful or not positive outcomes directly related to that.
I have never been so proud in my life.
If it makes your patient feel more comfortable and you say, hey, would you like me to elevate your legs? And they say, yes, please.
Then do it. Elevate those legs.
Absolutely. They should absolutely be laying down for a number of reasons. One, it does help balance out your vascular blood volumes, so it's not all going to the bottom. But more importantly, if they're pre-syncopal and they're on the verge of passing out, you don't want them standing up, right? That can lead to
falling down,
right?
And head injuries and things like that.
The larger they are, the harder they fall.
The harder they fall.
Right.
All right. And what about if we're in the room, or we're in the article we talk about it's a fairly frequent thing that happens with chair massage events where people will get up off a chair or even in the middle of a chair session, probably related to any combination of dehydration and low blood sugar and direct pressure on the carotid sinus from a badly placed cushion. Someone will pass out. Mm-hmm. Again, we don't usually see this on a massage table, but we might see it right after someone gets up from a chair, gets up from a table, and they actually do lose consciousness.
Right.
Now what do we do?
Well, so again, a lot of the stuff with treating syncope is to try and prevent it beforehand if we can. So we want to do slow positional changes when it's possible. Slowly moving from a laying down to a sit, slowly moving from a sit to a stand, especially if they do have that history.
Well, and when we do talk about being in attendance while someone comes up to sitting, if that seems necessary, so that they're not on their own.
As far as once it has happened, that's what you're asking about, right?
Yes.
Once it has happened, step one, and this is the hardest one. It's still hard for me, even after years in the field, is staying calm.
Don't
remember. This is a client's emergency. It is not your emergency. And I know that when we're in a field of, when we're compassionate people and we're empathetic people and we want to help other people, when somebody else is having a very bad day or even their worst day, we want to take some of that load off. But we have to remember that as care providers and advocates for our patients, the best thing that we can do is
Stay calm.
stay calm, be the anchor while they're, adrift at sea, right? Step one, don't panic, as Douglas Adams tells us. Step two, if they are not already, you want to help them lie flat.
All right, let's see. Where were we?
I was talking about the patient.
Yes. Start over with that story. So the other day,
I was called out to a scene for where there was a syncopal event. The person who passed out wasn't even my patient originally. I was getting called out for the patient's daughter who was having a febrile seizure. The kid was doing great. She was fine. She was recovering very quickly. She was not having a medical emergency, but the entire family had been sick that entire week. And while I was assessing the kiddo, mom suddenly, she grips my shoulder and she says, "I don't feel so good." And I'm looking at her, and where before she had been walking around, talking, looking fine, suddenly she was completely pale as a sheet. She was covered in sweat, and her pupils were like the size of dinner plates. And I was like, "Oh no!" So we helped her down to the floor very quickly. We did end up elevating her legs just out of muscle memory. Took her blood pressure, and it was about 80/40.
Ooh, that seems suboptimal.
Yeah, it's not ideal. It's not ideal. So all we did was that we laid her down, and even before I started any fluids, her pressure had improved dramatically within a few minutes, and she felt better very quickly after laying her down, just from that positional change.
Yeah. So that's a great story about someone who's just got an awful lot going on. It was one thing too many.
Yeah, no, she's completely exhausted, completely dehydrated, had been sick herself, and solo parenting like two kids who were also sick for the entire week, just completely pushed to her limit. And then we had a collapse.
Yeah, the body hit the limit and then seesawed.
But, it all comes back to the context of what's going on. And even in people that don't have a history of passing out, you put them in the right circumstances and it'll happen.
All right, so step one, don't panic.
Sorry.
Step two, laying down.
Step three, this is just a general recommendation that you probably won't have too many issues with in the massage client's scenario, but if they have any tight-fitting clothing that's going to restrict their airflow, their ability to breathe, if they have like a tight-fitting collar, if you can do anything to loosen that so that they have a clear airway, that would be totally appropriate. If they are able to follow directions and it would bring them some peace, you can offer them some cool water. Again, it depends.
We're not worried. Once they're awake again, we're not worried about them choking or something like that.
Yeah, as long as they're able to follow commands and are, having a full conversation with you and able to protect their airway, and you ask them, "Hey, would you like a cup of water?" If they say yes, please, give them some water.
Awesome. Okay.
And then most importantly, do not resume the massage.
Yeah, maybe not.
It's
not the right time.
Recommend. And then we should have the discussion on what point you should call 911.
When should a massage therapist call 911?
Right.
If someone has presyncope symptoms or if they actually pass out.
Okay. So again, it's all in the big context. First and foremost, you as a professional should know what you can handle and what you can't handle, right? So
scope of practice,
both in your scope of practice and also you as a person, right? If things are feeling out of control, if you feel that the client's health is at risk for any reason whatsoever, call 911. Just because the ambulance comes doesn't necessarily mean that they're going to get a bill. It doesn't mean that they're going to be forced to go to the hospital, right? They're going to have the equipment out there to do some more in-depth assessment, right? They have a cardiac
skills
monitor.
To do that.
They can take an EKG. They can do a 12 lead. They can take a blood pressure. They have the extra training and the extra, they can take a blood glucose, right? They have all these extra tools to help you when things are getting a little out of hand. So when in doubt, if you're thinking that, should I or shouldn't I would lean towards the should.
You should.
Rather than the should not. That said, if you are looking for some lines in the sand to draw, for me, I would call 911 probably immediately if somebody actually lost consciousness, fully had a syncopal event, was not responding to you, had a collapse. That in of itself, that needs a more thorough assessment. Unless you know this person personally and you've seen them have prior collapses like this, and this is identical to all the other ones you've seen, not likely. I would call 911 just for that. Some other things that I would call 911 for, any change in their mentation, their mental competency. Decision-making capacity is a fancy word that we use in our charting. If they are not able to answer questions appropriately, if they've had a change.
Some kind of speech problem.
Yeah, speech problem, right? Because
these are signs of stroke as well as anything
possible
else.
Stroke, possible low blood sugar, possible overdose, any number of things.
Good point.
That you don't have any real control of and you need a deeper assessment for. Some other things I would call 911 for is if they've stumbled and, they may not have completely passed out, but they could have still fallen. And if they hit their head or they injure something, that should that should buy you an ambulance ride or at least an assessment.
It seems to me most massage therapists, at least when I was in practice, made a habit of getting an emergency contact.
Yes.
And so if the person passes out for a few moments and then wakes up and is fully oriented, would it be appropriate to call their emergency contact rather than emergency services?
Yes, especially if the client is telling you, this has happened to me before.
Okay.
I don't want to go to the hospital. That's totally fine.
Yeah,
if they are able to
call my person,
yeah,
and they'll
don't send them on their way. Don't just be like, okay, you seem fine now.
go drive home.
Go drive home. They need somebody to,
they need some care.
Pass off.
Yeah.
That is the right thing to do, both, in my opinion, both morally and legally, is my...
It's nice when those two things are the same thing.
It really is nice. Some other things that might accompany a syncopal event that would warrant 911. Chest pain, any difficulty breathing, seizures is something that can happen quite frequently with a syncopal event. Anything like a drug overdose, if you're suspecting that for whatever reason, or an allergic reaction, which doesn't always present as anaphylaxis, right? Sometimes it can present as severe vomiting. Sometimes it can present as muscle spasms. Sometimes it can present as significant hives.
And shortness of breath.
Shortness of breath, right? Those are, the extra contextual clues that, hey, there's something else going on here.
Something more complicated.
Besides a standalone syncopal event.
Right. Okay. We've gotten way more material than I was anticipating, which is fantastic. I want to thank you so much.
We're done?
Mr. Werner, for joining me today.
I thought we were just getting started. All right.
That was awesome, and maybe we can do this again to talk specifically about seizures in massage.
Oh, that'd be my pleasure. I have a lot of thoughts about seizures. I have a lot of opinions about seizures. So let's get into it.
Awesome. All right. Well, thank you so much, Nate. I really appreciate your being here. Thank you for joining us, and see you next time.
Anytime.